Hey guys, welcome back to Pathology Insights. Today we'll be talking about the markers of testicular tumors, a very important topic, as in the vivas and the theories. So first, we have very common testicular tumors called the germ cell tumor (GCT). Okay, germ cell tumors called the GCT. Okay, so first we need to remember this part: pan GCT marker. Okay, pan GCT marker. What it is? It is SAL4. It is SAL4. Pan GCT marker is SAL4. So if SAL4 is positive, it means it confirms that it is a germ cell tumor. If it is not positive, it means it is not a germ cell tumor because it is a germ cell tumor marker. Okay. If it is not positive, that is, if it is negative, then it cannot be germ cell tumor. It should. The other common variety is the sex cord stromal tumor. This is SCST. It is sex cord stromal tumors. Okay. So what you would do, it is SF1, inhibin alpha, and calretinine. Okay. So these are the markers for sex cord stromal tumors. Okay. Next, if it is you are confirmed by SAL4 that it is a germ cell tumor, then you look for OCT4. If OCT4 is positive, then you look for CD30 and SOX2. If both are positive, it is an embryonal carcinoma, a variety of germ cell tumor. If both are negative, it is a seminoma, a variety of germ cell tumor. If OCT4 is negative, then you look for glypican-3 and AFP. Okay, alpha fetoprotein. Okay. If it is positive, then it is a yolk sac tumor. And it shows beta HCG negative. It shows beta HCG negative. And if glypican-3 and AFP are negative, then you look for beta HCG and GATA3. If they are positive, it is a choriocarcinoma. Okay. Choriocarcinoma, it is beta HCG positive and GATA3 positive. If both are negative, then it is spermatocytic tumor. Spermatocytic tumor. Another important difference also given in Robbins is here. See, in embryonal carcinoma, c-KIT is negative, but in seminoma it is positive. Okay. D240, it is negative in embryonal carcinoma, it is positive. These are two other important differences that you should remember. Okay. So this is this is not a workup or a flow, I mean to say, this is basically how you can easily learn. I have made this how to learn. Okay. So if someone asks what is positive in embryonal carcinoma, you directly say SAL4 because it is germ cell tumor. SAL4 should be positive. Okay. Then OCT4 is positive. Then CD30 and SOX2 is positive. Okay. What is positive marker for seminoma? Then SAL4 must be there. Then OCT4 must be there. Then CD30 and SOX2 should be negative. Okay. And c-KIT and D240 should be positive. Okay, that it has been made such a way to learn and make it easy to memorize and reproduce in the exam. Okay, thank you.